go ahead, put your hand flat on the machine, all the way forward, squeeze the peg until traffic lights up here. Awesome, when the lights are gone, it'll say remove 10, so take your hand out. Now do it 2 more times. Cool, so here's your access code. Every time you want to use the direction, you're going to go to one of these gates over here. You'll see something that looks just like this. You're going to type in your number, press enter, put your hand in, and the gate will open for you.
Okay, great. Thank you.
You're welcome.
So what is an electronic medical record? It is a digital version of a paper medical chart that contains all the patient's medical history. It's an efficient way for providers to diagnose and treat patients. Another similar idea are EHRs, which are electronic health records. EHRs place accurate and complete information about a patient's health and medical history at a provider's fingertips. They are both quick, efficient, and organized. Providers are given access to the information they need when they need it. Reliable access to complete patient health information is essential for safe and effective care. This is helpful for patients with busy lives. For example, with e-prescribing, a way for doctors to electronically prescribe and refill medications, patients can have their prescriptions ordered and ready before they even leave the provider's office. Patient care and information used to be recorded as patients were admitted into a hospital, then the information would be transferred to the patient's floor. Once the information was received by the terminal on the floor, they would record the info for orders on medications or tests. These requests were generated at that floor, then forwarded to the doctors and nurses. After, the info would be sent to central computers and then relayed back to the office. Now, as far as drugs are concerned, the nurse in the pharmacology unit would be reminded at a certain time of the day when and how much of a drug he or she should administer. Today, we have sleek iPhones with 4G speed and state-of-the-art technology. We have iPads, laptops, tablets, and even most books are offered electronically. This is the generation we live in, the generation of technology. The world is making an expansive amount of technological and scientific advancements each day. However, there are many who do not agree with this way of life. Patients want hard copies. They want files in hand, not stored in an electronic database. The information stored in EMRs and EHRs are not easily shared with providers outside of a practice. A patient's record might even have to be printed out and delivered by mail to a specialist. Healthcare is a team effort, and shared information supports that effort.
Health Stop blogging team. And since you're watching this, well, you are already in the information age. I mean, you can't be doing this on a typewriter, right? Well, some areas, though, the old-fashioned ways still seems to be the way of life. Take the medical profession, for example. Paperwork. I mean, I deal with this stuff all the time. And the medical profession seems to be waiting in it. Medical buildings have rooms just full of paperwork. Well, paperwork can sometimes lead to big problems. A recent New York Times article found more than a third of people on New York State's Medicaid and other public health insurance programs failed to re-enroll on time. The major reason? Too much paperwork. The state is now looking to streamline the process. In Minnesota, a paperwork mistake cost Linda McDougall both her breasts and left her suffering infections. McDougall underwent the double mastectomy at United Hospital in St. Paul, Minnesota. Hospital officials say the tragic mistake began in the pathology lab, where her biopsy slides and paperwork were mixed up with another patient's because they were sitting in the same tray. Of course, there's the big problem with medical records. They take up space. Imagine how better utilized office space would be with electronic medical records. Say goodbye to bulky file cabinets. And how about this? Paper prescription pads with messy writing. It's a worldwide problem. A recent study at a major hospital in Italy found 24% of prescriptions illegible. Another 30% were incomplete. Of course, mistakes can happen anywhere, be it on electronic platforms or, yes, the old-fashioned way. So it's important that a staff is very well trained in using electronic medical records. Bottom line here, though, is with advances of technology, you might save a few trees and save your office some more space for the real business, treating patients.
Although these current systems are not 100% foolproof, the real question is anything 100% secure? Chances are, probably not. While privacy plays a major role in the decision to switch from paper to electronic, so does patient care. At the end of the day, giving the patient the best treatment, along with full confidentiality, is our intended goal, and that is why it is this idea for a better administrative system, and it's very prevalent today. According to the article, True Healthcare Reform means cutting costs and simplifying administrative processes, published in the Healthcare Payer News. $190 billion is wasted in excess administrative health costs each year. They stated this is equivalent to 30 cents of every dollar, enough to cover the healthcare insurance premiums of 150 million workers. It is also named the second largest category of waste, trailing the category of unnecessary procedures.
Electronic medical records. Currently, our office uses Practice Fusion electronic medical record. Our pros for our office is it will eliminate paper trails. Patients are more involved in their care, and it's space saving. Also, it provides information that we're able to share to patients' data to different providers. Okay, for the lines between the EMR and the EHR is the Internet Medical Record is basically charting on the computer. I believe that using electronic medical records is slowing down the doctors, and majority of the providers and staffs are spending more time on the computer than focusing on patient care and patients' needs.
There is always going to be a way to better the current system, but unless it is discovered and implemented in a timely fashion, the idealistic results may not be achieved. This is why we need to encourage our readers to take a look at the past, a look at the present, and then think about the future they would like to see. The implementation of a new technological solution holds the promise of improving the lives of many.